Oculoplastic surgery is a subspecialization of ophthalmology. So it's essentially an individual who's a super specialist for plastic surgery procedures around the eye. So that usually starts from the forehead to the brow, the upper lid, lower lid, and the midface. So plastic surgery, as I'm sure you're aware, has been divided into several subspecializations. So just like any field, there's an expert for eyelids, there's an expert for liposuction, there's an expert for nose jobs. So what we are an expert at is anything to do with the area in and around the eye. So that's what oculoplastic surgery is. And in order to do oculoplastic surgery, you first need to be an eye surgeon, so you have to complete the full training program. Then you do several years of further specialization in plastic surgery only around the eyes. So you can imagine if you're spending all those years just focusing around the eyes, then the level of knowledge, depth, and expertise we have with the structures and the functions around the eye is significantly greater than someone that normally deals with the whole body. So this is why we have this kind of subspecialization and clear focus on treatment and procedures around the eye. And the reason for this subspecialization is that the eye, is being such a sensitive structure, any eyelid procedures you do will have an impact on the eye, and it relies on the individual performing that procedure to understand how to minimize any impact on the eye and to give you the best aesthetic result without actually causing any negative impact. So the kind of procedures we deal with are from non-surgical, so we're talking about fillers and Botox, through to laser treatments, so skin rejuvenation around the eye. So we use very powerful skin lasers that are designed for specifically skin around the eyes, which even dermatologists and other skin specialists don't use frequently. In addition to that, we have surgical procedures that we have developed over the years that have minimal impact on the eye but give maximum aesthetic result, such as treating eye bags. So we use specialized laser techniques that involve a no scar approach, so there's no visible incision on the skin, but we internally treat and remove eye bags. We also then use specialized laser techniques and internal approaches to elevate and support the eyebrow and the eyelids to basically give long-term natural results. Being an ophthalmologist, Botox was first discovered by eye doctors. So we've had the longest experience with using Botox and muscle relaxants, probably more than any aesthetic practitioner, because we started to use it for blepharospasm, for myotonia and neurological issues before we started to use it for aesthetics. So we have a very strong feel of the function and action of muscles and how to relax them in a safe way. And the same applies to fillers. So we use fillers to rejuvenate the area around the eye, from the lower lid tear troughs that people have, through to camouflaging their eye bags, through to volumizing and rejuvenating the whole facial area.